In 2023, the head and neck surgery team at the Royal Melbourne Hospital implemented the Enhanced Recovery After Surgery program, otherwise known as ERAS Plus, in collaboration with the West Metro Health Service Partnership. ERAS Plus aims to standardise care across the journey through diagnosis to discharge using best available evidence.
Our intention was to improve patient recovery, outcomes and experience. Through ERAS Plus, patients undergoing major head and neck surgery now have access to additional preoperative support in their prehabilitation process from allied health and nursing. We provide tailored advice and education based on the patient's planned surgery and what to expect afterwards. Since implementing the ERAS Plus program, we have seen a reduction in both major patient complications and length of admissions.
Patients are progressing more quickly after their surgery and getting home earlier than ever before. But let's hear from the patients. How did ERAS Plus impact them?
Well, I'm Bob. I live about 400 kilometres away in the Upper Murray in northern Victoria. I came here in August and had an operation on my tongue. I found I was very lucky to come to the Royal Melbourne. They cut off half my tongue, put part of my arm back in there to replace it.
My name is Teresa Corso. I was diagnosed with a squamous cell carcinoma on the left part of my tongue, and that involved treatment at the Royal Melbourne Hospital, which included about a quarter or just over a quarter of my tongue being removed, and then having a forearm flap that was helped to reconstruct my tongue.
The knowledge that I gained in the pre-surgery was directly in line with my after-surgery care, and it certainly helped me a great deal. We came down and had to visit dietitians and speech therapists and the doctors, and I felt fairly prepared. I had the mannequin for the trachea put in your throat, and that was very detailed, and I think that was very important. There was about 3 or 4 emails with little videos on them, so that was really good to have that again.
The lead up to surgery is overwhelming. I had a lot of fear, and what I found was beneficial for me with the videos that were put forward by the Royal Melbourne Hospital. They highlighted what I was to expect, being prepared from a physio perspective on what I would need to look at as part of my recovery. The opportunity to speak to a psychologist and just share some of the inner demons, some of the thoughts that I didn't really want to share with my family, some of those fears that I had that I didn't want to express to my children. It just felt great to have someone who could just be a sounding board for me. Yeah, I thought it was very good. It was spoiled, really. Initially, we were in there supposed to be in for 2 weeks, and anyhow, it was only about a week. I was ready to go home. To be a head and neck cancer patient is a really daunting process. Having that preparation of what I would need to expect from wound care, from the types of food that I'd be able to eat, that for me allowed me to understand that there's a process. There were some moments that stood out for me. One of them in particular was when I was trying to learn how to eat again, or how to just have a couple of tablespoons of soup, and just having the encouragement from the dietitians. A bit of a mission to come down. We usually have to camp overnight at a motel or whatever. We did telehealth too, so I'd take pictures before I came down of this and the throat and the mouth and everything. They would look at that, and then they'd be forewarned what was going on when I came down, especially the nurses, and they'd work out what they needed. And sometimes they'd make an adjustment over the phone, saved a lot of money and time and stress. I like to have one-on-one care. So I found some of my services were on Zoom and they were great, but I did like coming into the hospital for my care. I am grateful that there was a protocol. There was already a structure for what was needed for someone in my situation. In hindsight, if I did not have those services, I don't think I would have been fully prepared, and not even physically prepared, but more so mentally and emotionally prepared. I've had a few months since then and taken a while to recover, but I've put on the weight and
I feel good, so no excuses. So I go fishing most of the time.
So I'm just on 5 months post-treatment. I've gone back to paddling. I did my first 14K training session recently. To be able to do that was just incredibly overwhelming, and I was filled with such joy and tears.